For years, air pollution makes headlines, but only when we cross the hazardous levels, which is in peak winter months. The problem is a year-long one, and the repercussions are now being felt. Chronic obstructive pulmonary disease, or COPD, is becoming more prevalent than ever in India. This is a lung disease, and the cases have beyond multiplied in the last 3 decades. So what really causes COPD? Regular exposure to throat irritants causes inflammation and obstruction in the airways. When the obstruction gets severe, breathing becomes difficult. This condition is known as COPD. While smoking has traditionally been the most common cause of COPD, data shows that 48% of COPD deaths were due to non-smoking causes in India. Air pollution is the second most common cause. Several studies show that toxic air greatly increases the risk of developing COPD. Here's what the symptoms look like. Breathlessness is a major symptom. Doctors say there are less obvious signs as well. Weakness is a sign. Weakness in doing activities you were used to is a sign. Pain in the limbs, excess mucus production, chest congestion, frequent chest infections, and chronic persistent cough. Like in the case of 55-year-old Sunil Gupta, who was diagnosed with this. A smoker for years, his symptoms were classic symptoms of COPD.
So when he came to me for the first time, he had appearance of a person who was short of breath. His face was a little red, and he was walking with, even in walking from gate to the chair, he was feeling short of breath. Okay, he was pursing his lips a little bit, and his chest looked large anterior posteriorly. He seems to have a little less muscle in his arm. All these things were visible on a inspection only.
काफ़ी टाइम खांसी रही, तो जब 1-1.5 महीने खांसी रही तो फिर थोड़ा सा सांस फूलना भी शुरू हो गया, और जैसे मौसम चेंज होता था तो फिर भी 1-1.5 महीना खांसी वगैरह, कफ वगैरह. तो इस तरह से धूल से भी मुझे एलर्जी शुरू हो गई थी. पहले तो डॉक्टर्स ने मुझे मेडिसिन्स पे ही चेक करके मेडिसिन्स पे ही रखा. 15 दिन बाद फिर प्रॉब्लम्स जब कफ एंड कोल्ड ख़त्म नहीं हुआ, खांसी वगैरह, तो उन्होंने फिर मेरा PFT कराया. मुझे आइडिया था एक्चुअल में. फिर मैंने शुरुआत में तो मेरी स्मोकिंग छूटी नहीं. अभी मैंने 2-3 साल पहले ये छोड़ दी है. बाकी इसी की वजह से था मुझे इसको.
The biggest challenge in dealing with patients suffering from this infection is timely diagnosis.
When you start getting little bit of shortness of breath while walking, your usual activities, supposedly you are walking 5 kilometers and then you start feeling breathless on walking 5 kilometers, don't ignore it. See your doctor, diagnose it. Specifically people who are smoker or who have exposure to some fumes, smoke, the people who work in buses, or somebody who is exposed to diesel. Some goldsmiths, they have direct exposure to that, to melt the gold, they are directly exposed to smoke. Or even the ladies in the house who are exposed to passive smoke.
Medicines are needed to reduce inflammation and mucus in the airways. For treatment, these medicines could be lifelong. Wear masks and air purifiers when air pollution levels worsen. Avoid outdoor exercise is what doctors say. Psychological counseling is often recommended to reduce stress.